하겠습니다. The main topic of my presentation is what can you do to prevent Alzheimer's? Have you ever heard about Alzheimer's disease? Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and brain cells to die. And in some way, this terrifying disease is likely to affect us all. Part of the fear around Alzheimer's stems from the sense that there's nothing we can do about it. Despite decades of research, we still have no disease-modifying treatment and no cure. A lot of people have that hopeful expectation of living into old age. And if we are lucky enough to live long enough, Alzheimer's appears to be our brain's destiny. But maybe it doesn't have to be. What if I told you we could change these statistics, literally change our brain's destiny without relying on a cure or advancements in medicine? Let's begin by looking at what we currently understand about the neuroscience of Alzheimer's. Here's a picture of two neurons connecting. The point of connection, this space circled in red, is called the synapse. And the synapse is where neurotransmitters are released. This is where signals are transmitted, where communication happens. This is where we think, feel, see, hear, desire, and remember. And the synapse is where Alzheimer's happens. During the business of communicating information, neurons release a small peptide called amyloid beta. And most neuroscientists believe that the disease begins when amyloid beta begins to accumulate. Normally, amyloid beta is cleared away, metabolized by microglia, the genital cells of our brains. But if the cleansing doesn't work properly, the accumulation of amyloid beta causes amyloid plaques, the main reason of losing synapses to be formed. And this presence of amyloid plaques accumulating is the initial step into the disease. We think it takes at least 15 to 20 years of amyloid plaques accumulation before it reaches a tipping point. Reaching that tipping point makes our brain to lose synapses, which causes the clinical symptoms of Alzheimer's. So, if you're a scientist trying to cure this disease, at what point would you ideally want to intervene? Many scientists are betting big on the simplest solution: keep amyloid plaques from reaching that tipping point. So the cure for Alzheimer's will likely be a preventative medicine. And this information is actually really good news for us, because it turns out that the way we live can influence the accumulation of amyloid plaques. So there are things we can do to keep us from reaching that tipping point. First, sleep. In slow wave deep sleep, our glial cells rinse cerebrospinal fluid throughout our brain, clearing away metabolic waste that accumulated in our synapses while we were awake. Deep sleep is like a power cleanse for the brain. What else? Cardiovascular health. High blood pressure, diabetes, obesity, smoking, high cholesterol have all been shown to increase our risk of developing Alzheimer's. Some autopsy studies have shown that as many as 80% of people with Alzheimer's also had a cardiovascular disease. Aerobic exercise has been shown in many studies to decrease amyloid beta. So a heart-healthy Mediterranean lifestyle and diet can help to decrease the risk of Alzheimer's. Third, building an Alzheimer's resistant brain. This is one more thing you can do to protect yourself from experiencing the symptoms of the disease. And it has to do with cognitive reserve. Some studies have shown that having a high level of cognitive reserve means having more functional synapses. People who have more years of formal education, who have a high degree of literacy, who engage regularly in mentally stimulating activities, all have more cognitive reserve. They have an abundance and a redundancy in neural connections. So even if they have a disease like Alzheimer's compromising some of their synapses, they've got many extra backup connections, and this buffers them from noticing that anything is amiss. Learning to speak Italian, meeting new friends, reading a book, or listening to a great TED Talk are good ways to build an Alzheimer's resistant brain. And if, despite all of this, you're someday diagnosed with Alzheimer's, diagnosis doesn't mean you are dying tomorrow. Keep living. You won't lose your emotional memory. You'll still be able to understand love and joy. You might not remember what I said 5 minutes ago, but you'll remember how I made you feel. And you are more than what you can remember. Thank you.